Hello, my name is Patrice Hicks, and I am an emerging vision scientist and a postdoctoral research fellow at the Kellogg Eye Center at the University of Michigan. As an ophthalmic epidemiologist, my research has a few arms. One is identifying which vision-threatening eye diseases and conditions impact identified populations or communities the most, and the other arm focuses on which risk factors are associated with these vision-threatening eye diseases and conditions within these identified populations or communities. I specifically research environmental, genetic, clinical, and demographic risk factors for vision-threatening eye diseases and conditions. My research passion lies within addressing health disparities in eye health and vision care that disproportionately burden specific populations or communities, such as racial and ethnic minority groups, women, and individuals from lower socioeconomic status. In conducting research within these areas, my goal is to improve outcomes pertaining to eye health and vision care within these populations to achieve health equity. During my doctoral studies with the mentorship of Dr. Margaret DeAngelis, our laboratory focused on vision-threatening eye conditions in 3 distinct geographically isolated underserved populations, including the Navajo Nation, the Confederate Tribes of the Goshute Reservation, and a Mayan cohort from Guatemala. I identified which vision-threatening eye diseases and conditions impacted these populations the most, as well as which clinical, demographic, genetic, and environmental risk factors were associated with the eye disease and condition outcomes. These 3 populations were either underrepresented within the vision research literature or not represented at all. These studies furthered our understanding of the prevalence of vision-threatening eye diseases and conditions, as well as their associated risk factors within these populations. Furthermore, these studies highlighted that healthcare services developed at a broad level may actually ignore the needed change to address health disparities between populations, so healthcare services must be tailored for each individual population. In my current fellowship with the mentorship of Dr. Maria Woodward and Dr. Paula Ann Newman-Casey at the Kellogg Eye Center, I will apply these concepts to additional populations and communities to further address health inequities in vision care. I will specifically focus on vision-threatening conditions that impact both the cornea in the front of the eye and the back of the eye in the retina. This research can inform the planning and delivery of accessible, acceptable, quality, and appropriate care to different populations and communities. My rationale for my research focuses on highlighting that it is essential to understand who is at most risk for vision loss and blindness, what factors are associated and modifiable with vision loss and blindness, and how vision loss and blindness can be impacted through health policy and healthcare. Identifying individual community vision care needs is imperative to creating a population health approach to increase health equity within eye health and vision care. It is essential to work towards diversity, equity, and inclusion within vision research. The research that I have outlined can have lasting implications by working towards representation within vision research studies that impact eye health and vision care outcomes to address risk factors, as well as implement both interventions and policy. Moreover, this research has implications for creating an impact at the individual patient level through precision medicine, but also at a population health level through public health initiatives. This research highlights the importance of diversity within eye health and vision research. If there is not representation within research, the precision medicine approaches may not apply to individuals that are not represented within this research. This also applies to the population level, in that the needs of underserved communities may go ignored. In addition, within research, minorities may be inappropriately aggregated into larger groups, so their actual health wants and needs may be ignored. My research can have lasting implications by working towards representation within research studies that impact eye health and vision care outcomes to address risk factors and implementation of both policy and interventions. I thank you so much for your time today, and I hope you have a great day.